Hey guys, I'm Dr. Dawson. We're going to talk a little bit today about how eczema works and what kind of things make it better and what makes it worse. Those who've seen some of my other videos have already heard how allergies, asthma, and eczema are all sort of interrelated. They're all in the same gene. They're sort of a situation where our body overreacts when it comes in contact with the real world. I think eczema is the easiest to understand because it involves our skin. It's easy to think of our skin as a barrier between our bodies and the outside world. And then when something comes in contact with our skin, that it might make it red and irritated and makes me where it kind of itches. And so that's essentially what eczema is. So how does it work? Essentially, on your picture here, your skin is a bunch of layers of cells. That's what these round things are here. The new cells are sort of formed at this bottom, and then they slowly work their way up. By the time they get to the surface of your skin, they're really just a bunch of dead cells. But nonetheless, they form our protective barrier on our skin. At the lower portions of our skin, we have these oil wells, and they make oil, and they pump it up to the surface, and that's what this line is up here. This is the oil layer over the top of your skin cells, and it sort of serves as think of it as the plastic protective barrier. And the thicker your plastic barrier is, the better skin protection you have. There's a couple of vicious cycles that sort of get involved to make things worse. The first one is you'll get something that irritates your skin. And so we'll make these little marks here, and the skin is all irritated. And when we get that irritation, not only does it look red and inflamed, but it interferes with the oil production from these little oil cells, and so they can't get as much oil to the surface. And so now you have a thinner oil layer, which doesn't protect you as well. You're more easily irritated. You get more irritation, less oil, and so this keeps getting sort of worse and worse. So that's one of the vicious cycles that we're going to talk about. The second is that all this irritation makes your skin itch. And so when you start scratching your skin, well, all that scratching irritates this skin more. You get less oil production, and you get even thinner oil layers. So those are the two sort of vicious cycles that get involved and make eczema seem to kind of get worse and worse and build on itself. So what do we do about this? Well, I'm going to give you a list of 4 things that I want you to do. You don't have to worry about writing this stuff down. You can just go to drtomdawson.com, and I've written it all down for you. But this is essentially what I want you to do. So the first is we want to decrease your child's oil losses in their skin. That means less hot water. Don't let them sit in the hot tub for long periods of time. Less soap. A lot of babies with eczema will only give them a bath every couple to 3 days maybe, and use as little soap as you possibly can. When we're drying them off, instead of rubbing with the towel and scraping all the oil off, we just kind of try to pat them dry. So number 1 is decrease your child's oil losses, preserve the oil that they have in their skin. Number 2, we add oil. We want to make that oil layer of their skin thicker. Some children require expensive, very fine lotions, but for most children with eczema, any lotion will do. My recommendation would be get the one you like the way it smells the most, because that's the one you're going to use the most. Put it on whenever you think about it, especially when they've been in the water, like in the tub or in the pool. If you put the lotion on right after that, you'll trap some of that extra moisture in the skin, and that helps even more. The third is we want to decrease the redness. Anywhere your child's skin looks red or rough, it's irritated, and it needs an anti-inflammatory to decrease that inflammation. The most commonly and best anti-inflammatory we have now is the little steroid cream. So whether it's the over-the-counter hydrocortisone cream or whether it's the prescription cream that you get from your doctor, either of those, whenever your child's skin is red, we need to be applying those to the skin. Now, a note that I've made previously on steroids is there is way too much fear of steroids in this world. We have had steroids for 75 years. The low-dose things that we're using for your child's eczema, I have children that have to be on it 365 days a year. Do not worry, it is not going to stunt their growth, it is not going to diminish their immune system or thin their skin in the doses that we're prescribing for these kind of things. So, anywhere there's red, use a steroid. And as we work our way down, then if you're doing all those things, but your child is still itching in bed at night when they're sleeping or going to sleep, then that means we need to help them with itching, and so we need to give them a little bit of Benadryl. You're pretty much always going to be doing number 1 and 2. You're going to be decreasing the oil losses, and you're going to be adding the oil. When things get a little red and rough and irritated, we're going to add the steroids. And when they're doing that and they're still itching, we're going to maybe end up adding the Benadryl and doing all 4. When things are better, we'll work our way back up and down the list. And we're going to be doing these things for the next couple of years while we're waiting for your child to outgrow the eczema. So those are the main things as far as what you're going to be doing to help take care of it. A couple of tips that'll help, I think, with your child's eczema. Number 1, teach your child how to scratch. These children are itchy. It's just mean to say don't scratch. Poor child is going to scratch. There's nothing you can do by talking to them to get them to quit scratching. So let's teach them how to not tear up their skin. Their normal scratching where they use their nails and they scratch off the top layer of the skin and they irritate it more, that's bad. You can get the same thrill if you tell them take their knuckles, push down hard, and just rub that skin in a circle, and that will give you the same thrill of scratching without tearing up the skin with their nails. So push down hard, rub in a circle without dragging your hand over the skin. Just rub that skin around in a circle, and that'll give you the same thrill. That's number 1. Number 2, there's not a lot of outside things like things you eat that make eczema a ton worse. Probably the only one that's worth checking for would be dairy. And so what I try to do is take a 2-week period and eliminate 95% of the dairy. And let's see if your child's eczema is a ton better at the end of that 2 weeks. If it is, that doesn't prove it's dairy. You would then need to go ahead and add a bunch of dairy back in for the next 2 or 3 days. And if it gets a lot worse at the end of those 2 days, then dairy is a likely thing, and I would try to reduce the exposure to dairy as much as you can. Other things like cats, it's hard to test for those things. You probably have to go on vacation for 2 weeks without the cat to see if their skin gets better and see if it gets worse when they get back around the cat. If you suspect outside things, I think at that point it's probably worth maybe seeking out the help of an allergist to look for those things. So eczema is pretty straightforward, but it is going to require persistence on your part to take care of it. So the main things we want you to do, get your list. Like I say, you can download it from the website. Find you a lotion that you like the way that it smells. Get you either over-the-counter hydrocortisone or a steroid cream from your doctor and use it liberally. And get some Benadryl so that you'll have that if we need to give them some for itching at night. And then I'm just going to ask you to be patient with this because this is this malady will try your patience. And let's hope that it goes away this year instead of next. I hope that'll help.